Okay, today we're going to be talking about healthcare associated infections, the different types, how it affects the healthcare system, and the patient and institution, healthcare institutions. According to the CDC, there's a variety of common microorganisms that are typical within healthcare settings that infect patients. There's a lot of different points of entry for these infections to take place while the patient is hospitalized. And today we'll go over a few of the different types and how they gain access into the bloodstream. MRSA, methicillin-resistant Staphylococcus aureus, is a common one that is seen in hospital settings. It's a bacteria and it's resistant to many of the antibiotics available. And so it takes an extremely long time to heal the patient and reduce the bacterial load in the bloodstream, months at a time even, and at worst it can cause death. According to the CDC, most of these infections are spread from healthcare providers in between patients when people go from room to room and don't perform the proper hand hygiene or proper sterilization during surgical techniques. These are how these uh, organisms manage to gain hold of the patient. These infections lead to prolonged hospitalization, more calls for the patient, and a lot of times Medicare, Medicaid, insurance companies won't pay for treatment of the patient if they've acquired these infections within the hospital setting. There are many different points of entry for these infections to gain hold. They can be bacterial, viral, or fungal, such as a CLABSI, which is a central line associated bloodstream infection. And a central line is usually placed for a patient who's receiving care and has a difficult time with gaining intravenous access. And these are points of entry if it's not handled properly and proper surgical technique and sterilization isn't used when caring for patients with central lines. The CDC has stated that there was actually a 3% decrease in infections last year in 2024, which is a good thing, but they're still a major concern in hospital settings. A CAUTI, which is a catheter-associated urinary tract infection, is another very common form of infection that gains through a urinary catheter placed and is not cleaned properly and can lead to another type of bacterial infection. Pseudomonas or E. coli is usually the most common. A patient usually requires, according to Amy Collins, who wrote an article in the National Library of Medicine, within 48 to 72 hours is when patients acquire a hospital infection. That's either after surgery or a procedure. SSI is a surgical site infection, which is from not using proper sterile technique. And these are just a few of the many different access points and the way that bacteria can gain access to the bloodstream. The U.S. and many other countries are taking extreme measures to reduce these incidences and improve patient care. And the CDC also has very strict guidelines on how to perform hand hygiene and how to put on protective gear for the patient and the healthcare worker. Thank you.